My name is Shirley Richardson, and my presentation today is nasogastric tube insertion. Nasogastric tube insertions are not complex procedures, but can create serious harm to the patient and even death if not properly inserted. The National Patient Safety Agency reported data from 2003 to 2005, 11 death cases, and 1 case of serious harm to a patient whose nasogastric tube was not inserted properly. My presentation today will focus on the technique or procedure and risk management. Nasogastric tubes may be ordered for a couple of reasons. One, to decompress the stomach of air or liquid content, or it may be prescribed for fluid to provide feeding or fluids for the patient due to dysphagia or such as with strokes or tracheotomy tubes. Now, prior to beginning your procedure, you will need to gather your supplies. These supplies would include a nasogastric tube. They vary in size from 8 to 18 French. What I have here is an 18 French tube. You will also need a catheter tip syringe, 60 cc's, stabilization device, piece of tape, lubricant, suction apparatus and suction tubing, disposable gloves, and a cup of water with a straw in it. Now, prior to beginning the procedure, you want to first explain the procedure to the patient to alleviate any anxiety or apprehension from what will take place. Next, you will wash your hands and place your gloves on. After you place your gloves on, you will want to measure the length of insertion for the NG tube. And to do this, you will need to take the nasogastric tube out of the packaging. You will measure from the base of the nose to the earlobe down to the xiphoid process, such as this. Earlobe down to the xiphoid process. Once you get the measurement length that you need, you will place a piece of tape there to verify placement. Verify that that's the marking that you would not want to surpass once you do the insertion. Now, you would drape the patient with a cloth or a disposable pad and use the lubricant gel to lubricate the tip of the tube. Now, right prior to beginning this portion, you want to verify which nair air flows more freely through. And to do that, you would ask the patient to occlude one nair and breathe normally through it, and do the same thing with the other nair. The nostril that air flows more freely through is the one that you want to select for the initial insertion. Now, once you lubricate the tube with the lubricant, you begin the insertion. And once you get to the floor of the nostril, that's when you ask the patient to begin swallowing with the cup of water through the straw. And as they're swallowing, you want to rapidly insert the tube down the esophagus. Now, if you incur some resistance, you want to possibly rotate the tube and attempt to continue with the advancement. If there's continued resistance or the patient begins to cough or choke, you want to dispel the tube some, allow the patient to rest, and attempt to continue with the insertion. Now, if you continue to incur some resistance, you will have to pull the tube out, allow the patient to rest, and take some deep breath, and lubricate the tube again, and attempt the insertion with the opposite tube nostril. Now, once the tube is in position, you will want to verify placement. And you secure the end of the tubing to with the tape or the stabilization device that comes with NG2 packaging. Now, to verify placement, you connect the 60cc catheter tip syringe to the end of the tubing to aspirate stomach content. Other times to verify placement is prior to any feeding, or if the patient begins to vomit, or you notice a noticeable drop in their oxygen saturation, you will want to verify that it's placed. Or if the patient complains of abdominal discomfort, you will want to verify that it's properly in position. Now, once you aspirate the stomach content to verify that it is in the proper position, you want to reconnect the tube either to the suction apparatus, if that's prescribed, or leave it capped off for feeding or whatever is prescribed for. Now, if it is prescribed for suctioning, you would take these suction tubing, connect that to the suction apparatus, and then connect it to the nasogastric tube. And the setting for the suctioning would depend on what is prescribed. And again, as I said, if it's prescribed for feeding, it would not be connected to the suction apparatus, but it will be capped off and wait for the feeding to begin. Any questions? Thank you.